Welcome back. January is Glaucoma Awareness Month, and what many may not know is more than 3 million Americans suffer from it. So here to share the importance of this disease is Dr. Clayton Whitney with Trinity Mother Francis. Good morning.
Good morning.
Thanks for having me.
Oh, we're happy to. So what is glaucoma?
Well, glaucoma is a disease where the eye fluid that is used to maintain and nourish the eye actually rises to a pressure that causes damage to the optic nerve. Some 3 million people in America have glaucoma, but half of them don't even know they have it, and it's a leading cause of blindness.
Yikes.
Oh, I think I'm having flashbacks now because I think that's when you go in for the visit to the ophthalmologist, the eye doctor, and something's put on your, is it a pressure test?
It's a pressure test.
Oh my gosh.
But the interesting thing is 40% of people that have glaucoma might have a quote normal pressure. So some people, the pressure can fluctuate. The pressure can cause damage at levels that would be considered normal in some people. And so the only way to know for sure is to check the pressure, but also look at the optic nerve. So a regular eye exam is very important, especially as you get older, and especially if you are African American. The incidence is almost double. So in the last decade, or between 2000 and 2010, the incidence of glaucoma went up 20% just because of the aging of the population. And so it's really a public health issue. It costs the taxpayers about $1.5 billion a year in medical cost and lost revenue.
Yikes. So is there any way to test yourself? Or what are the
There's really not, because it's a silent disease. The old timers called it the sneak thief of sight. Because by the time you have symptoms of glaucoma, you've lost 80% to 90% of your nerve fibers. So it's really a silent disease. So the best thing is to have a regular exam, not just checking the pressure, but to look at the optic nerve. And it's especially important if there's any family history of glaucoma anywhere in the background.
Okay, wow.
Well, then what do you do if you discover it, if it's getting bad?
It's very treatable. Initially, it's treated with medication, much like you treat high blood pressure. You use a drop daily or twice a day to control the pressure. If that doesn't work, we can do laser treatment. And if that doesn't work, people can have a filtration surgery operation if necessary.
Oh, man.
Most of the time, the great majority of the time, it's controllable with medication or laser.
Okay, so there is treatment though, so that's
absolutely.
Promising.
That's why it's so important to diagnose it.
Oh man, and how many are affected here in Texas? Do we know that statistic?
Well, I don't know the exact number, but I mean proportionately, you know, it's one of the leading causes of blindness in the state.
Yeah. Oh.
Okay.
Anything that diet can help or hurt, or not necessarily?
No, but Dr. Harry Quigley, when I was a fellow at Hopkins, he was the head of the glaucoma department there, treated the first President Bush, and he felt that regular exercise is equivalent to one medication. So he thinks it's good to exercise in addition to having a regular exam.
Okay.
And that can be, you know, walking 20 minutes every other day. It doesn't have to be running a marathon.
No, that's good.
And you mentioned that this affects people who have their family history or they are older.
They're at higher risk.
Okay.
As I mentioned, in African Americans, it occurs about a decade younger. It's more rapidly progressive. But oftentimes there's no association or reason, and that's where it's a screening exam, a regular exam, is really worthwhile. And as you get older, it's more important to have a regular exam. After age 50, every 2 years would be recommended.
Oh man.
Because it seems like there's a whole host of things that can go wrong with the eye. I think about macular.
That's right, that's right. And another leading cause of blindness is detectable with an exam. But glaucoma is probably one that has the fewest symptoms. There is a type of glaucoma where people have a sudden pressure rise that's painful, and that's an emergency, but the majority of glaucoma people have no symptoms. The first one, where I mentioned just then, where it's painful, is more a structural thing based on the structure of the eye, the shape of the eye. And it's curable with a laser treatment. But most people have no symptoms. That's why it's so important to screen for it, and that's why it's a national issue.
Oh, wow. Well, where can we go to read more about all this?
You can go online through the American Academy of Ophthalmology's webpage, and also through the National Eye Institute.
Perfect. Well, thank you so much.
Thank you.
You bet. Glad to be here.
Good information.
Thank you.
So coming up next on Fox 15.